Great, so we'll go ahead and get started. Thanks everyone for coming, for those of you who are here in person, and for those of you online as well, to this very special Grand Rounds. So hello and welcome to this special edition of the University of Alberta Child and Adolescent Grand Rounds. Before we begin, I would like to acknowledge that Alberta is located in Treaty 4, 6, 7, and 8 territories, and is a traditional gathering place for the diverse Indigenous peoples, including the Cree, Blackfoot, Métis, Dene, Nakota Sioux, Saulteaux, Siksika, Piikani, Kainai, Sumi, Stoney, Nakota First Nations, and many others whose histories, languages, and cultures continue to shape and enrich our communities. As we gather today to discuss identity, lived experience, systems of care, and the future of neurodevelopmental and genetic medicine, I am reminded of the words of Richard Wakamis, the Ojibwe Canadian author and journalist. We are story, all of us. What comes to matter then is the creation of the best possible story we can while we're here. You, me, us, together. When we can do that and we can take the time to share those stories with each other, we get bigger inside. We see each other, we recognize our kinship. We change the world one story at a time. In many ways, today's conversation is about stories. The stories we bring as professionals, researchers, advocates, family members, and individuals with lived experience, and how those stories can help shape a better future for the children, youth, adults, and families we serve. My name is Daniel Moreno de Luca, and in my role as the CASA Research Chair and on behalf of our team, I am delighted to welcome you to the Prisma and CASA Research Chair Child and Adolescent Grand Rounds. This new partnership creates an opportunity to bring truly outstanding voices in the autism, neurodevelopmental, and rare genetic spaces to our community, not only to learn from their experience and expertise, but also to foster meaningful collaborations through genuine dialogue, connection, and shared purpose. Today's event would not have been possible without the tremendous support of CASA, the University of Alberta, Alberta Health Services, Recovery Alberta, and our Prisma team, especially Molly Goldman, who played a pivotal role in coordinating today's visit, and our colleagues at the Faculty of Medicine and Dentistry's Office of Lifelong Learning, better known as L3. Our format today is also intentionally different. Rather than a traditional lecture, we will have the opportunity for a candid conversation focused on visionary voices and wayfinding in the autism and rare genetics spaces. Together, we will explore how professional expertise and lived experience can help identify priorities, address systemic barriers, and advance more equitable, inclusive, and effective care for individuals and families affected by autism and rare genetic conditions. We are privileged to be joined by three remarkable leaders, each of whom brings unique perspectives shaped by their professional roles, personal experiences, and commitment to systems change. We have Karen Kelm, who is the Chief Executive Officer of Fragile X Canada and a nationally recognized leader in the rare disease advocacy, family engagement, and patient-oriented research. Her work is grounded in the belief that lived experience represents a valuable form of knowledge capable of transforming research, care, and support systems. Through her family's journey with Fragile X syndrome, Karen became deeply involved in rare disease, neurodevelopmental disability, and family-centered research communities. She is passionate about connecting science, research, and community voices to improve the real-world outcomes for individuals and families. Today, Karen works to foster collaborations among families, clinicians, researchers, policymakers, and organizations to advance research, strengthen care across the lifespan, and support meaningful systems change. Her leadership is guided by curiosity, dignity, connection, discovery, and possibility. We also have Dr. Heather Brown. Dr. Brown began her career as an elementary school teacher and is now an associate professor in the Faculty of Education at the University of Alberta. Her research is grounded in neurodiversity affirming, strengths-based approach that centers autistic voices and identities. As an autistic researcher, she is passionate about supporting the academic achievement and well-being of autistic children, youth, and adults. Through community-based and participatory research, she empowers autistic individuals to embrace their neurodiversity while helping us better understand the factors that support flourishing at home, at school, and in the workplace. She leads a dynamic team of collaborators and graduate students across Canada and internationally, and takes particular pride in mentoring emerging scholars, especially those with lived experience of neurodivergence. We also have Geoff Pradella, who serves as the Chief Executive Officer of Kids Brain Health Network, a national organization dedicated to improving outcomes for children and youth with neurodisabilities and their families by accelerating access to supports, services, and innovations across Canada. With extensive experience spanning government, higher education, the private sector, and the not-for-profit sector, Geoff is committed to translating research into practice, fostering partnerships, and advancing innovation that meaningfully improve lives. He currently serves as the chair of the Genome Alberta board and is a recipient of the Queen Elizabeth II Diamond Jubilee Medal in recognition of his contributions to research, innovation, and public service. Please join me in giving our panelists a very warm welcome. So with that, I'll just move over to our table and we can start our conversation. So let me advance these slides. We have some housekeeping information here for us that will apply, especially as we move towards the Q&A part of the seminar. And then we'll just leave this slide in the background, but I will stop sharing the screen so that we can focus on the camera and the table of products. Cool. Thank you guys for being here today. I think this is working out okay.
Good.
So we had talked about some questions that we wanted to address, and this would be a really nice opportunity to get to know a little bit more about each of your work. And perhaps we can start by the questions that focus on identity, perspective, and purpose. So we all bring multiple identities to our work. What identities, experiences, or perspectives are most present for you today? And how do they shape the way that you approach your work? Anyone want to take a stab at that first?
We've nominated Geoff.
Okay.
Yeah, I mean, multiple identities really is kind of my brand. Started life actually doing international trade negotiations and then trained to be a lawyer. My mentor at law school said, don't take it the wrong way, but I think you should think about going into medicine. So a wide variety of training experience in negotiations, which is actually very relevant to the work that I'm doing. Just landed a couple of wins with the Government of Canada last week through that skill. But then trained in law and medicine and clinical ethics. I've had practiced in that sphere for quite a number of years. Professionally, and while I was on the faculty of the University of Edinburgh, started to focus, as you tend to specialize, right, in genetics, which it was the University of Edinburgh was where they created Dolly the sheep. So that's sort of some years later, but it was during a period where the cool new idea was epigenetics, right? The influence of environmental factors on the expression of genes. And then I got very involved in pre-implantation genetic diagnosis and screening, which is the ability to start to predict future lives because of the Human Genome Project. Sitting on a panel for an advisory board to the UK government brought my first experiences with persons with disabilities, because they were coming to the panel to testify they saw a slippery slope, right? We were talking about, on my panel, it was certain forms of cancer, shouldn't we allow screening for this? But the disability advocates were coming to present at these events because they saw a future where they'd be on the table and they'd be the question at some point, potentially. Thankfully, that's never happened. But it's that experience really that has been a major influence in what I do today. So a senior executive with this peripatetic multi-identity journey through various professions, and then focused in this area of vulnerable patients, persons with disabilities. I now have lived experience with a nephew who's significantly autistic that has really enriched the work that I do, and I think every day that I get out of bed and I go to work for Liam. It's kind of, it gives you a different sense to have that personal connection. So that's a bit of identity soup.
Thank you, Geoff. That was really great to get to hear about. Maybe Karen, would you like to tell us?
I need an Uncle Geoff. I usually like to tell kind of my journey and stories, and I met the most amazing person in my life, and I married him, and we were so excited to have a family together, and my kids were going to be so loved and supported to achieve all that they could. And then along came some delays, which led to what was leading down a path of an autism diagnosis. I'm not one for labels. You could have called my kid the purple people eater. It didn't matter to me, but it just needed to feel right. And the autism diagnosis didn't necessarily feel right. And then along came this genetic disorder called Pradella syndrome. And it's not something we knew ran in our family. We didn't know anything about it. But I think once the diagnosis comes into play, you go into act mode, learning and acting, and ensuring you can do everything you can to see success. Throughout that journey, we also had 2 other children who now also have a diagnosis of Fragile X syndrome. Fragile X being the #1 known genetic cause of autism. And there's also related disorders. For the 1 in 150 women have the pre-mutation that leads to premature ovarian insufficiency, and there's also an ataxia related to the gene mutation. I think for quite some time, it was just doing, behavioral interventions, therapies, anything we could do to support our children so they could have the best quality of life. And one day, we're trying to get out of the house. It's chaos. We had an appointment. We had to go somewhere, and I'm standing at the bottom of the stairs, and Noah comes running in, and he's in his early teens, and he comes running up the stairs. I'm like, dear Lord, we need to go. We need to get in the car. Let's go. And he's running up the stairs, and he's wearing a jersey, and he takes the jersey off, and I'm like, hey, well, you got to hang it up. Stop making a mess. Let's go. And he comes down the stairs, and he has an Edmonton Oilers jersey on. Mind you, we're from Calgary, but and I'm so caught up in what we have to do. I took a moment to actually think about what was happening. And what was happening was Noah realized where we were going. And so he changed his jersey. He changed his jersey because we were going to go see someone who was an Oilers fan. And he knew if he wore the jersey, it was a form of communication for him. And it gave him that opportunity to interact and connect with this person that we were going to go see. And so I think along the way, we talk a lot about speech delays and communication challenges. And I realized he had so much language. He had a desire to belong and communicate. We just weren't giving him opportunities to do so. And he found his way to do it. And so taking that moment to really see who he was and what he wanted and how he wants to belong in life really changed what I was doing. And it made me realize there's a bank of information and knowledge out there that we don't know. Because we talk about deficits, we talk about phenotypes, but we don't talk about the positives, like the positive exposures. We don't, and not in a toxic positivity way, but there's so much that we can elevate within that space and what belonging does. And so I think that moment at the bottom of the stairs and taking a breath outside of the monotonous tasks of what we need to do really leads to who I am now and what I do in a general sense, that it is that sense of belonging and community and where we are. It's that knowledge that we need that we don't have. that's really going to complement well with the knowledge we do have. So that would kind of be my story to your answer.
Thank you for sharing, Karen. And I think we are starting to hear some of those common denominators that unfortunately we live in a little bit of a reductionistic world. And because we're tasked with solving problems, then we're looking for problems to solve. And people are much more than their challenges and much more than their strengths. So this is definitely one of the threads that we wanted to focus on and emphasize. So perhaps, Heather, you can tell us a little bit about your journey as well.
Yeah, absolutely. So my name is Heather Brown. Like I said, I was originally an elementary school teacher, but at this very same time that I just started my sort of elementary school journey, I also had my son, Aidan. So Aidan was originally diagnosed with PDD, NOS, and ADHD. He was a little sensory processing monkey, and he was quite a challenge because he was really, really busy, really, really active, and a lot of sort of emotional dysregulation. At the same time, I had a little boy in my class as an elementary school teacher in grade 2 who had autism. And I didn't know what that was at that time. And so I was reaching out to all the people around me to find out information because I wanted to make sure that I supported the child as best I could. But as I was sort of watching this little boy in my class, I was like, I kind of think Heather is in grade 2 might have kind of acted the way that this little boy is acting. And then I had a therapist at the time, and I started reading Dr. Satsmari's book, another famous Canadian researcher if you don't know. But anyway, so Dr. Satsmari at that time had a book. I was reading through it. I was making all these notes, talking to my therapist. And then eventually we sort of agreed that I probably had it, and I went and got a formal diagnosis. So now for a person who didn't know anything about autism, I now not only was autistic, but I also had a son who was very neurodivergent and potentially autistic himself. So in terms of my lived identities and how they sort of shaped everything, back then it was really hard to become an elementary school teacher, like a permanent position. So I had a lot of long-term occasionals filling in for other teachers. So one of the things that you could do to sort of get ahead of the pack was go to grad school, get your master's in special ed, and then you could, you'd be more employable, for lack of a better word. Mm-hmm. But I'd also just gotten that autism diagnosis, and little bit that I understood about my ability to find patterns and how helpful that is in research and so on and so forth, I thought, well, maybe I can go try out research. It's something I've always wanted to do. I love doing it. According to what I've been reading, I have the kind of brain that often does well in research, so why don't I give it a try? So there I was. But now, if you fast forward, it's really interesting. I think what my lived experience helped me understand is how valuable my lived experience is to shaping my research is also true of all the other people that I bring around my lab or bring into my research. Like, in other words, we always say I'm one person with autism, one person with autism. Well, I mean, the fact that I'm there is making a huge difference to, what types of research questions we ask and how we treat our participants. But I don't know exactly how every autistic person is going to respond or understand certain information. And so what we've done is we've brought in all these other grad students who are neurodivergent or autistic themselves. And we have community collaborators who are autistic. And, with all of these perspectives, I have learned so much, not only about autism, because one of the things I think I'm actually an expert in is really myself, which sounds incredibly self-centered. So it kind of makes me really confused. But that's what I know. I know autism in and out because I know all the little facets or traits or pieces of autism that are my lived experience. But then by broadening this sphere, by having all of these other lived experiences around me, I'm starting to learn all of the different variations. So one of the biggest shocks for me was, I'll give you one example, is I have a wonderful grad student in my world whose name is Mika Pabia. And Mika Pabia, so for me, I have ARFID. So I have that avoidant and restrictive food intake disorder. So I eat basically nothing. And I eat no texture. And it's been the biggest problem that everyone has talked about my entire life is Heather's eating. But I never knew that you could have the opposite problem, that the exact same trait could be expressed in exactly the opposite way. So Mika, she's sensory seeking around food. She wants as much variety as she possibly can. She wants the intensity of the different flavors. She's willing to try anything. It's the same trait. It's exactly the same trait. It's just expressed in two different ways. And I feel like a lot of when going back to strengths, a lot of what we talk about, like some of my greatest weaknesses are also my greatest strengths. And so, like, yes, we need to acknowledge the challenges, but we also need to acknowledge the gifts that those traits often bring to our lives. So I guess that's a very long sort of answer to your question.
But thank you for sharing that, Heather. I think it's a lovely example of how you're using that experience and also how you're taking perspective and where we can emphasize that there's so many different versions of being on the spectrum and on being different, that's really valuable. And I think it allows us to drive the point home that we don't want to be reductionistic as well. So when we engage with the autism or the neurodevelopmental community, it's not enough to have one conversation and tick off a check mark when you're submitting a grant saying that this is what you did. But if you want that meaningful engagement, you need to make sure that you acknowledge all of that diversity and all of that heterogeneity, which is a lovely strength, without undercounting the challenges that I know many of people in our communities face. There's also so much richness in that space that doesn't get acknowledged as much, and that can be truly a skill, as you pointed out. So thank you for sharing.
And I'd also add to that in that it's not also reductionistic, but it's also conformist. I mean, how fabulous for you to say, I have this perspective, this lens, and this way I approach the world, but you're just so curious of everyone else and how they approach the world, and you don't expect them to do the same as you, but learn from them to say, it's okay to be you and what you do. I don't expect you to be like me or be like Daniel or be like Geoff, but what can we do together to really move things forward? So I think that's so valuable.
That's such a good example, Karen, and it makes me think almost from an evolutionary perspective, thinking about natural selection and the selection of specific traits that are going to allow someone to thrive in a given environment. But we tend to think about that at the individual level. But there's so much richness even at that level of analysis that comes from having a diverse population. Like if we're thinking about, let's say, an out there example, giraffes, and how long their necks are. If there's a drought, then you need the giraffes that have the shorter necks because they can more easily adapt to no longer being able to reach those high leaves. So once we think about at a population level, the relevance of that diversity, it's extremely important for all of us, and that's where richness comes from. So I appreciate your comment as well.
Well, and I like that. I kind of want to add to that. You've met one person with autism, you've met one person with autism, and I've met one Geoff, and I've met one Geoff. I think there's so much uniqueness that you bring to it, and that you get out of bed for your nephew. I don't have an uncle that gets out of bed for me necessarily, but yeah, that's pretty amazing.
Yeah, that's really lovely to hear about what drives us. And I think it's a nice segue into our next question, which was thinking about examples of how those identities influence your decision-making and your leadership and research and advocacy effort or clinical work in ways that may not be visible to others. So Geoff, you were talking about your nephew, which I think it's also a lovely anecdote. And you were also talking about that interface between law school and med school and some of your time in Scotland. So again, all of those things come to the table to shape us and to make us who we are. But what would be some of those invisible, in quote marks, things that drive you guys?
Yeah. Well, I think on the personal side, obviously, the importance of my nephew, Liam, and those various identities. So in that context, I'm an uncle, son, brother, but 6 godchildren, a couple of whom I think are probably neurodiverse. And so, there's that personal relevance on one hand. And then, I'm a scientist at heart and a lawyer and ethicist. So professionally, I really geek out on the science. I drift into all sorts of things that fascinate me intellectually. And so pulling all of that together, I'm drawing from experience in negotiation, my love of science, the intellectual challenges around disabilities and neurodiversity in particular. But, I think all of us, a very dear mentor, shared with me that, it was an oversimplification, but look at the people around you, and we all make decisions based on fear or on passion. And if they're on fear, we're nervous. We don't go out, we don't take risks, we like the known. So many of our kids are living in fearful spaces. They're fearful of taking chances because of expressions of their neurodiversity. I consider myself very fortunate that I'm the eccentric risk taker, but passion is an invisible force that really drives everything that I do. Passion about the things that express intellectually, that express personally and emotionally, are huge. And then, what really drives me is just the reality of neurodiverse, neurodisabled children who, depending where they live in Canada, are on 2 to 7 year wait lists, right? As a combination of the wait list to get a diagnosis that lets you get into another line and wait to get into a program. And in the worst of the Canadian provinces, now your child is 9. And they've typically aged out of the programs, but more importantly, geeking out on the science, those first 9 years are the most significant years of brain development in our entire lifetime. So those children who lose that critical window, lose it forever. There is nothing we can do after that that's going to make up, because our brains have started to form and mature. So part of my passion is I feel like we stand on a burning platform, and there are thousands of kids out there that, for all sorts of reasons, are essentially abandoned, and whose lives will never be as great as they could have been if we were successful at doing the work that my organization does, which is bypassing all the provincial gatekeeping and getting supports and programs and activities into the hands of kids and families when they're as young as 3 to 6 months. So that's an invisible obsession, passion that our kids need us. And we need to change this rubbish world that they're struggling to get supported.
Thanks, Geoff. And I think that passion shows through. And I wanted to touch on 2 of those themes that you brought up. So one is the passion, to go back to that. I think that drives all of us. And it's evident when that's the motor that keeps us going beyond whether or not you got a grant or this particular job or not. Like, that's definitely the point that helps you keep going, because it's not easy to give up on those passions. And actually, we've built up a lot on those passions. It's one of the things that we see quite a bit in the kids and in the adults that we see clinically, but acknowledging that many people with diagnosis of, let's say, autism or neurodevelopmental conditions don't really need even to come and see us clinically. But we've used the passions piece as a way of delving into those deep interests to celebrate that uniqueness, instead of just having that be something that is all-consuming, that is a footnote in someone's story. Once you start focusing on a checklist of symptoms, then why isn't that a much bigger player in their stories? And how can you leverage those passions to get the type of work that you're doing? We're all passionate about something. We all have really deep interests. Some may be deeper than others, but that's definitely an entry point for really lovely interventions. So I was glad to hear you talk about the passions. And I think the other piece that you brought up and that you embody as well is that convergence and overlap between neurodevelopmental and brain health and genomics in both of those roles. And I think that's also one of the themes of our table just here. We know that in the autism and in the neurodevelopmental space, we can find a genetic cause in up to 1 out of every 3 kiddos or adults on the spectrum. And we know that that's a very heterogeneous group as well. So it's unlikely that you'll find 2 people with the same rare genetic cause. But those worlds coexist and find each other and merge And the point that you were making across is really important in the sense that we can always do something to help people achieve their maximum potential, regardless of the starting point as well. So even in the presence of different rare genetic conditions that may increase the chances, let's say, of autism, we all have a maximum potential. Genetics are not reductionistic, and I feel that it is our ethical obligation, all of us and everyone else out there, to help people have the tools to reach that maximum potential, however that looks. So it's another really good way of emphasizing both the relevance of some of those factors, but the lovely opportunity to intervene and to mobilize supports and services without being reductionistic or just fatalistic and thinking, well, this is what happened from the get-go, there's no other chance to intervene, or this is the outcomes that I'll have to face just because I have this host of conditions. So thank you for that.
Exactly right. And yeah, there is the ethicist identity, right, that looks at these tied with genetics. So the vast progress in all sorts of areas of medicine because of the Human Genome Project and our expanding understanding of genetics and now genomics, and a lot of good comes from that. And tremendous, our organization focuses on the creation and scale up of access to therapeutic supports and programs that just help kids. Some of them based on neuroplasticity, right, the repetitive stimuli, and that causes changes in the brain that, build some coping skills. In the space that we're in, though, it'd be great to understand, and there's a lot of genetics work on what are the underlying characteristics that we might be able to identify genetically that leads to neurodiversity. Great. But mindful, I think, to your point, throughout that journey, our kids aren't broken. They don't need to be fixed, and they don't need to be cured. Like, this isn't a disease. This isn't a fatalist condition. We all come to the table in life with challenges. I had many. So our kids are just diverse. So there's kind of this tension between the capacity of medicine and our sense of humanity and ethics and treating our kids like they're persons with supports will have better lives. And yeah, so there's a tension between this idea, we could cure that, or are there things that we can understand better so that our therapeutic interventions can work better in a different variation of precision medicine, but we're not oriented to fixing and curing our kids because they're not sick and they're not broken. They're just different.
We have a problem because we only have 25 minutes left. Okay. So I would say invisible, I mean, a lot of people know me, they know my family, they know my journey. That's definitely not something that's invisible, but I think what's invisible is what I do is selfish. What I do is very selfish. It's selfish because my biggest goal in life is that I live 10 seconds longer than my kids. Because I don't know if they're going to have the care, I don't know if they're going to have the support. So I think because we're in the rare genetic diagnosis and the cure, it's such a controversial topic. And I'll rewind a little bit to say, as a parent, not as Fragile X Canada, but as a parent, our audience here are psychiatrists, we have, our industry, we have teaching, we have learning, but as a parent, we're part of every single piece of that. And I think that's where things you see the tension, you see the complexity, because we see every piece. We see the understanding the genetics and learning about it, even though we don't have a history or past experience in that. We see the clinical care. We see the social systems. We see, we're just going to say politics, but we'll leave it at that, especially right now. And it's so complex, it's so defeating, and I'm angry. I'm angry because we celebrate our research systems where we have the Genome Project and we understand and can identify all these rare diseases. But then what? Nothing right now. I mean, we're waiting for the cure, we're waiting for the gene therapy. Why? Because we can't rely on our systems. We can't. They change with the political system, they change with funding, they change with opportunity and supports. And so when we talk about things like family engagement and, you know, and I hear, oh, well, we don't want to burden families because they have so much on their plate, we'll make room. And we make room because of that. Because if we're not there to advocate and support and encourage and help fundraise and help provide the other perspective, we're not going to see change. And we can't sit and not be angry right now because it's not going to change anything if that's the case. So, I mean, I definitely advocate for the positivity and the strengths, and let's elevate that. But we do have to be angry with where things are going right now because there are wait lists, and that's not right. And so it's tricky. There's no black or white, absolutely. But
and that's such a good point, because it's always that fine balance between, as you were saying, focusing on the good stories and in our uniqueness, while making sure that we don't cast aside the challenges and the needs. And I'm just thinking about that comment about treatment or cure and the different entry points and perspectives that can happen there. So I think we all agree at heart that we need to celebrate that humanity and that uniqueness. And at the same time, if your humanity brings you to a diagnosis of autism through Fragile X syndrome and you also have seizures, you very likely want those seizures cured. So that's kind of the tension between how do you acknowledge the human component while making sure that that doesn't underscore the efforts to advance all of the treatment for people who need treatment, acknowledging that not everyone will need treatment or for the same reasons.
100%. And kind of, you know, what you're saying about meeting one autistic person is meeting one autistic person, but being curious and learning about other people. And I think we need to do that in this space. Like, Danielle, your work is really great in this. Like, do families want a genetic reason or exploration as to why this is happening? And we need to allow that to happen. We can't put up barriers. I mean, I could write a story from my emails of what I get, and it's like, physician won't test a family who has a history of neurodevelopmental challenges, and they ask for Fragile X testing, and they're told, well, your child doesn't look like they have it. I mean, we're not born with tattoos, right? And so for example, myself, do I want a cure for my children? Well, they're all adults right now. Would I go down that path? I'm not sure. But if Sally over here wants it, I respect that decision. I'm not going to shut them down and say they're wrong and they shouldn't do this. And that's where I think a lot of the work that you're doing at Kids Brain Health is amazing, because you're giving the tools and the immediate access to support and resources. So when our systems are failing us, there is possibility and hope with what's out there.
We're providing options.
And you're building knowledge out there so that, you know, we're coming to an age where AI is going to be there, and AI is giving everybody all this information about what to do going forward. And if we don't have a large bank of knowledge and information about everything, then what are we going to be focusing on?
It's such a good point, and it makes me think about autonomy as being one of those extremely important goals. Like, I feel our ethical obligation is to make sure that the standard of care recommendations are available to everyone, not to put them in place, but to allow families to choose the path that's right for them based on that availability. So it's
100%.
always also that tension between making sure that we're not overtly paternalistic in either positive or negative ways. So going back to genetic testing, the message is not do it or don't do it, but have these conversations and empower families with well-based knowledge that is free of misinformation so that they can pick what's best for them.
And I think there's a responsibility. I know there's a responsibility within the basic science research community, the clinical research and care and communities to come together, support each other, and advocate for it. I mean, if we're coming up with all these rare disorders, we've given you the answer. No, you've started the journey. You haven't given us anything because there's no care afterwards. And so that's where we all need to come together.
Absolutely. And it goes back to that question about invisibility, and I'd love to hear also your perspective on that, Heather. But just before going into that spot, there is an unwritten or a hidden curriculum or a hidden incentive to keep what's invisible invisible. Because then that means that you don't have to allocate resources, be it because autism diagnoses are not happening or because genetic testing is not happening. And we've heard the argument that it's kind of drinking from a fire hose if you were to enact all of these standard of care recommendations and make them available to all of the families. Well, I want that problem. Like, I don't think that we can be passive just because of resource constraints. And I understand resource allocation and the challenges that come along with that. But I think what we need to do is to respond to those needs once we identify them rather than keeping them invisible. So with that, Heather, I was wondering, from your own perspectives, like, what do you think are some of those invisible parts of your identity that really inform your work?
I think my life has been hard, really, really hard. And you wouldn't see it if you just look at me sitting up here, because I did my makeup and I put on my fancy clothes and I am a prof. And so I look like, I've got it all together, right? But you don't see the chronic pain that I live with every single day. You don't see the, all these these invisible sort of conditions that you're not seeing outside in the world. And because my life has been so incredibly hard, I think what drives me the most now is trying to figure out how to support other people who are like me to do well, and especially my grad students. Like, we talk all the time about how important it is to have people with lived experience in these roles. Well, to get people with lived experience in these roles, they need a heck of a lot of support, because these structures and these systems are not made for neurodivergent brains. And so I think what really drives me the most, at least right now, is seeing those grad students and wanting them to succeed. Because, for example, I've got another grad student named Izzy. She's one of the first grad students I've got into our clinical psychology program, so school registered psychologist. At the end, she'll be. And I am so proud of that. I'm so proud that Izzy is going to make it through this program, and she's going to be a registered psych, and she's going to be an autistic registered psych. So, but to get her there, it's going to take more work maybe than it might for other students. But the one thing that I want to say is, when I say more work, I think what I really mean is different work or different types of supports. So because I realize I just sort of misspoke there, because one of the things that I am really shocked about is my students will often tell me that they feel like I'm giving them special treatment, except that they won't talk to. So it came out because one student said it to another. Like, I feel so bad about myself. Heather's always giving me special treatment. And then the other one said, I feel so bad. What? I'm the one who's always getting. What they don't realize is that if you're just accommodating for those things they found challenging, and this was an autistic and a non-autistic student, by the way, but if you're always sort of just accommodating those challenges and then building on their strengths or leveraging their strengths, then perhaps they perceive it as getting special treatment. But to me, I don't actually perceive it that way. I just okay, you need a type of support. I'm going to give you that support, and then I'm going to let you run with your strengths so I can see you in that direction. So that's kind of what I would say is sort of the invisible drivers.
That is so powerful, Heather. Thank you for sharing. And I think we cannot understate the importance of having someone that you look up to, like your PI, like you in your own lab, sharing openly about some of the challenges and the struggles. Like, we tend to idealize our mentors or think that they have these very unique lives that are super well put together, and we all have regular lives that are full of cool things, but also challenges. So I think the power of you sharing those perspectives is extremely large. Thank you for doing that as well. And I think we've heard also a common thread, which is so much of the focus has been on mobilizing supports and services for individuals, but I would argue that there's an equally large focus that needs to happen at the society level. So we have quite a few questions for today, and I'm also mindful of the time, but one of the ones we had was about what you would print on a t-shirt, for example, if you wanted to get a message across. And I was thinking that for me, it would be a message that one of my mentors had in their office that said, make no little plans because they have no power to stir people's blood. And I think this was from an architect in Chicago. So just thinking about those big level changes and not trying to tackle them head on. And where I'm going with this little tangent is because I think there's a lot of changes that we can enact at the population level rather than at the individual level to make everyone's lives better. So just silly little examples, but thinking about fluorescent lighting overhead. Many of our kids and adults don't like that. I don't like that either. So why can't we use that perspective to make the world a better place for everyone? Like we don't. That's a nice way of addressing the experiences and the places for everyone. So again, thinking about the time. We can go on for several hours, I think, if they don't stop us. But I also want to be mindful about potential questions from the audience, either here or online. So we have about 12 more minutes, and perhaps we can move on to that side of our talk, just to see if there's anything else that people want to talk about. If not, I come prepared with quite a few additional questions. Great. But any of you guys here in the audience have anything that you'd like to bring up or hear more about?
Yes. I have a question. First, I appreciate the stories and sharing. I guess my question is, how do you feel the neurodiversity encompasses intellectual development disorder?
Thank you. So I'll repeat the question for everyone online. So the question was about how the neurodiversity movement encompasses intellectual disability overall. Do you guys have thoughts or perspectives around that?
Yeah, I think they're intricately intertwined. So our organization, we might say, is pan-neurodiversity. It's not just autism, it's not just FASD, and it encompasses things like intellectual and learning challenges, delays in development, even from a hypoxic birth process, right? So there are lots of paths that lead to the more common presentations or the spectrum of presentations. And intellectual and learning disabilities are at the heart and perhaps the most common among them. So yeah, I think for us, it's just part of the space. And we certainly include them and we're shifting even some of our language to neurodisability. So it's not just about the development process. Yeah, great question.
I ask because I don't see the same, as a clinician, psychologist, bias to my practice activity. But I don't hear the same kind of first-person language. It's one of thinking it's hard for me to frame it as a strength when kids are doing that. Arguably, it pulls resources. Like I could go on because I agree with like it is very common and prominent, even psychometrically. It's a factor analysis, not genetics. But in UK and Ireland, like learning disorders, intellectual disability are in the same category. They were really parsing things out, and I'm finding it hard to come up with a language to support the kids concerned from the neurodiversity.
I think language is so important, but the difficult thing is we always try and put individuals in their category, and it's eliminating so many people, because I think there's commonalities amongst all, and we're losing out when we put people in their boxes. for that purpose. I mean, we all know that the number 70 defines so much, right? But yeah, I think that could be a whole 1 hour conversation in itself. But it is difficult to really, again, we talk about the positives and the strengths, and I don't mean that in a care way. And so it's really hard to share that. But I think there's a lot of work that needs to be done. And maybe the work isn't necessarily done in diagnosis and language, but perspectives in how we care and support individuals.
Sure.
I think, so when we think about the neurodiversity movement, when we think of people with intellectual disabilities and autism or just intellectual disabilities, I think what the neurodiversity movement wants the most is to protect their dignity, to give them the autonomy to make choices, to not have to, so really what we want, so we're doing this co-design study in the school with Edmonton Catholic right now, and we have teachers involved, researchers involved, support staff, and we've got autistic students and autistic adults. But the autistic students, most of them came with intellectual disabilities. We asked the school boards to give us 4, and that's what we ended up with. I was really shocked. So I think on the one hand, I don't think people with intellectual disabilities necessarily care about what language you use. I mean, a lot of autistic people are, while we want you to use respectful language, what we really want you to do is tell the truth too. Like there's always a tension between just naming it as it is, like this is hard and it sucks, versus, making sure that you're using the right language. So I think if the person with intellectual disabilities is comfortable with the language that you're using, then I think you're on the right path. I think the most powerful moment for me with working these students in this co-design thing was at the very end. At the end of every session, they would have sort of a feedback form. That was part of the research. And I had been working with this one boy for most of the morning. And when I looked at his form, what he said, it was that UofA chose me. And so it's just, he was okay with being autistic. He was okay with, saying that he was challenged. But what meant the most to him was that this amazing organization wanted him to come and help with the research. That's what mattered to him. So I think finding what matters, and I talk a lot. There's another lady named Dr. Jackie Ryan. She has an adult son with an intellectual disability, and she talks a lot about, autonomy and promoting their autonomy. And one of the things that her son wants the most is pop and Pepsi. And obviously that's going to hurt him, right? He can't eat as much Pepsi as he wants. On the other hand, she can't completely deny him to having Pepsi because that is something that he truly loves. So I think getting parents to better understand that sort of tension, and about it doesn't always have to be that they're perfectly in control and they're following every rule and da-da-da-da-da. Sometimes they're allowed to go on about their special interests. Sometimes they're allowed to choose how their hair looks or how they're, what choices, they're activities they're doing. So I don't know if that answers your question, but that's what it brings to mind.
But I think I know where the difference comes in, though, is I have a 23-year-old son, and while I want him to have autonomy, if you're functioning at a 5-year-old level, that's a different story.
Yeah.
And so I think there's still a lack, these aren't the right words, but we don't have time for me to come up with them, a lack of understanding and awareness of the entire picture, of those individuals who are not going to be attending university as a grad student, but I don't know. It's another,
I don't understand, honestly. I was talking about kids with intellectual disabilities.
No, I think, Daniel, maybe you can help me out with this.
What I'm perceiving is a little bit of that tension between autonomy and your ability to make choices, even if some people think they're bad choices, and how do you have a supportive holding environment that allows you to make those bad choices without dramatically negative consequences. To what degree can you still make your bad choices within a space where people are caring for you and have your best interest in mind? So adults overall can have that autonomy many times in the absence of one of these diagnoses. But I feel that once that switch clicks, then we think that everyone needs choices to be made for them in a way that precludes them from having the adult experience of making a bad choice and dealing with those consequences. And at the same time, we have some potential very severe consequences of bad choices that may not be anticipating depending on where you are on a developmental level. So how do we create the space to make bad choices in a safe way, kind of?
Or even good choices.
Which has been one of the things my students in med schools have loved most, is when I give them the ethical conundrum of that exact question around autonomy. And, your patient is making a really bad choice, as doctor so-and-so. That doesn't make them mentally incompetent. So yeah, there may be very bad consequences. They have the right to make bad choices. But coming briefly back, I think this has prompted a thought in my head that our organization has shifted to a focus on responding to presentations of functional challenges. So it's an overstatement, but we almost don't care about the diagnosis. How you get to having an intellectual learning challenge, don't care. Autism, FASD really doesn't matter. If our goal is to improve your life, let's focus on how we respond to the functional challenges that you're presenting, which is why I think, without thinking about it, we've just included that as part of the work that we do.
Yeah. Thank you, Geoff. And perhaps, Natasha, if you're online, we have time for maybe 2 questions from online. If you don't mind reading those out loud to us, we'll see how the tech cooperates with us.
Hi, Daniel. Yeah, we actually don't have any online questions. So for those of you viewing virtually, please go ahead and add any questions into the chat if you have. But we have nothing at the moment.
Thank you. And in the meantime, for those of you who are Glenrose based, are those bells?
Oh,
okay.
Calling.
I think, it's probably a rapid response code that we don't have to do anything about ourselves. Okay, good. So we'll give our online participants maybe a minute more. But as we're waiting to see if any questions trickle in, I want to take the opportunity to thank you again so much for being here, to the 3 of you, and for everyone who helped us put this together. This is such an important and enriching discussion that we don't get to hear about as often. So being one of the people who does my presentations with PowerPoint slides and is very passionate about sharing your own research, the uniqueness and the value of these conversations is extremely important to me, and it wouldn't have been possible without the 3 of you here today. So thank you very much for being here as well.
Thank you.
Yes,
With that, let's give them a round of applause.
And I'll just say we're here to share our lived experience and what drives us. And I think in that care space, it's so important to look at yourself, the people that are here and those online, to say, what is your lived experience and what drives you? And similar to when I was sharing in the beginning, and you get into this tasks like I'm a psychiatrist, I'm a psychologist, and these are the things I need to do for my patient or families, to step outside of that task space as well and just take a moment to see what's happening. And that would be, it's a partnership.
Absolutely. And I think that's what's so beautiful about these conversations. Like, we all have all of these lived experiences and these unique aspects to all of us. So although we're focusing the conversation on neurodevelopmental conditions and genetic conditions today, it's a shared human experience, and it's a good invitation for us to remember that and acknowledge that for ourselves. So with that, let me stand up and share some of the last slides that are going to relate to the evaluation for today's talks. They want me to make sure that I show you guys this. So thank you for joining us. And I want to remind you that this talk was accredited for Section 1 mock credits, and that if you could give us your feedback following the link or scanning the QR code there, that would be very valuable to us. So thanks again to everyone who attended both in person and online. And thanks for a great one.
Thanks.
Thank you.